More than 1 in 10 adults suffer from chronic sinusitis. Our skulls house air pockets around the nose, called sinuses. They filter the air we breathe, thanks to the mucus they produce. Inflammation can block this mucus from draining. This is sinusitis. If sinusitis lasts over 12 weeks, it's chronic. It affects life quality deeply. Pain and pressure in the face are common in chronic sinusitis. This comes from inflamed sinuses filled with mucus. The blocked drainage causes mucus to build up, pressing on surrounding areas, causing discomfort. Nasal congestion follows. The nose feels full, breathing through it becomes hard. This is because the inflammation and mucus block the nose's narrow paths, stopping airflow. Then there's postnasal drip. Mucus flows down the throat. This leads to a sore throat, cough, and a hoarse voice. The mucus irritates, prompting the body to clear it. Next, thick mucus discharges from the nose, yellow or green. It often means a bacterial infection. The immune system fights off the bacteria, and the mix of dead cells turns the mucus thick and colored. Loss of smell and taste can happen, too. The inflammation affects the olfactory nerves near the sinuses. Facial tenderness and headaches might occur. Bending forward can worsen these headaches because of the pressure in the sinuses. Fever is rare but can signal an acute bacterial infection. Now, for the causes of chronic rhinosinusitis, allergies top the list. Dust, mites, dander, and pollen can trigger the inflammation leading to chronic sinusitis. Nasal polyps are next. These small growths block nasal passages and create inflammation. A deviated septum, an off-center wall between the nostrils, can also hinder drainage. Other factors include a weak immune system, conditions like cystic fibrosis and asthma, smoking, and frequent swimming or diving. In those with weakened immune systems, fungal infections can severely impact sinusitis. Treating chronic sinusitis takes a broad strategy. It aims to lessen inflammation, ease congestion, boost drainage, and tackle the root causes. Nasal corticosteroids like fluticasone, budesonide, and mometasone stand at the front line. They cut down on inflammation, make breathing easier, and help sinuses drain. Long-term use is common, but they might dry out or irritate the nose, sometimes causing nosebleeds. Saline nasal irrigation helps too. It uses lukewarm water to clear the nose, easing congestion and washing away irritants. Mix non-iodized salt and a pinch of baking soda in boiled water that's cooled down. Using a neti pot or similar device, the solution is poured into one nostril and allowed to flow out the other. It's safe for the long haul. Topical decongestants offer quick, but brief, relief. They're not for long-term use because they can make congestion come back worse. Antihistamines work well when allergies are part of the problem. Antibiotics like amoxicillin clavulanate or doxycycline step in when bacteria are to blame. But wrong use can lead to resistance, making them a choice only when necessary. Sometimes, surgery is the answer. Functional endoscopic sinus surgery clears blockages to restore drainage, especially useful for those with nasal polyps or big blockages. It often works well. With the right treatment, 60 to 90% see major improvements. While chronic sinusitis doesn't shorten life, ignoring it can lead to serious problems, even affecting the eye or brain.